Hello, Dallas. It's that time again. It's time to wake up and get wealthy. I am Terri Arends, the Group Fitness and Wellness Director here with the Arends Family JCC. And November is Men's Health Awareness Month. So we are going to get a little smarter and a little wiser when it comes to men's health. I am here today with Dr. Aggarwal, and thank you so much for coming on the show.
Sure.
And I just want you to share with our viewers a little bit about yourself.
Perfect. Well, good morning, everybody. As Terri mentioned, my name is Manik Aggarwal. I'm an internal medicine doc here in Dallas. Grew up in the area, married, have 2 young kiddos that keep me busy. I've been a primary care doc for a number of years, and last year I transitioned into a concierge medicine practice where I get to spend a lot of time with patients and have really great relationships with patients, and it's been a very rewarding experience. So I'm happy to be here. I think men's health is obviously important and under-discussed, and so ready to begin and start figuring this out with everybody.
Okay, well, correct me if I'm wrong, but I feel like that men's health really takes a back seat to women's health. So, I mean, I could be wrong on that, but I don't think I am. So, what's going on? Why is it like that?
Well, I think it's that most men, and in many ways myself included, we underestimate our symptoms, or we are dismissive of our symptoms. We attribute a lot of our symptoms to just being tired or being stressed and thinking that there's a lot of other fish to fry in our life. It turns out that our symptoms are very similar to women's symptoms, but women are just more mindful of their symptoms, and they're more aware of their symptoms, and they're more energetic about their symptoms. And so I think in the office, a lot of times men will come in after several weeks of symptoms, whereas women will come in after several days of symptoms. And sometimes that difference between days and months or days and weeks is the difference between a really good outcome versus potentially a not so good outcome. So I think we all have symptoms, it's just that some of us care more about them than others.
That's interesting, days versus weeks, where women just seem to get on the bandwagon a little quicker than men do. I wonder, why is that?
I wish I had a good answer. I mean, for my own personal life, I just think that, not that women don't have things going on, obviously in many ways they've got many more things than we do as men, but I think we're just not as mindful of it. You know, if I have an ache or a pain, I just regard it as, oh, I slept funny, or I ate something funny, or I worked out too hard, or I was playing with the kids too much, and I just kind of ignore my own symptoms. That's that little inner voice that we all have. I am more likely to ignore it than, say, my wife or my mom or another woman in my family. And so I would just encourage men and women, right? This is also, some women are like this, but I would encourage men and women to say, hey, we all have a doctor. We have a fairly easy way to approach our doctor. Just let them know what's going on. You know, myself and my colleagues included, we're here to take care of our patients. And we enjoy taking care of our patients, but we can't take care of you unless you tell us what's going on.
That's a really good point. You don't have that crystal ball, right?
I don't.
Right. Yeah. So if you did get out the crystal ball and it is working for you, what would you say would be the 5 main health topics or concerns for men as far as health issues?
Yeah. So I think number 1 and number 2 are without a doubt clear in my mind, and then 3, 4, and 5 are kind of in one category. So number 1 and number 2 interchangeably are heart disease and cancer. So when you look at what causes Americans to die, men and women, it's heart disease, heart disease, heart disease, and then cancer, cancer, cancer. And that really drives a lot of what we do in primary care, which is identifying and preventing cancers, and unfortunately we don't always prevent them, then obviously treating them if they already existed. So, you know, when we think about heart disease, what I want every man to think about is what causes heart disease? Because a lot of people worry about it, but we don't really know what it is. Well, there's 5 things you got to ask yourself, and these things are ingrained in my mind because I tell every patient of mine every day. But the 5 things are: do you smoke? Because if you do, you got to stop. Do you drink alcohol? If you do, you should reduce the amount that you drink, and we can get into some details about how much to drink and so on. Number 3 is blood pressure. Do you even know what your blood pressure is? When was the last time you got your blood pressure checked? It's not something that you know is high until it's really, really high. Number 4 is your cholesterol. You don't know how high your cholesterol is. I could be walking around with a normal or a slightly normal or a very high cholesterol. I would have no idea. And then the 5th thing is diabetes. Do I have diabetes? Do you, the listeners, have diabetes? And again, unless you've got a really severe case of diabetes, you have no idea unless you go to the doctor and get some blood tests. And so when I think about heart disease, it comes down to those 5 things. Your blood sugars, which is diabetes, your blood pressures, which is your blood pressure, your cholesterol, tobacco use, alcohol use. Those are the 5 things that I harp on patients, that I counsel patients on from a heart disease standpoint. The second thing that I think about with men's health is cancer screenings. So there's this misconception that anytime a man comes into my office that they're going to get a rectal exam. And I recognize that those are not comfortable and those are not enjoyable. But it turns out I rarely do rectal exams on patients. That is not part of a routine screening. That is not required on every exam. That is no longer the standard of care. And I can't encourage you all to understand that enough, because back in the day, maybe your dad, your uncle, or whomever did have to get annual rectal exams. That's just not the case anymore. So don't feel like, oh God, I don't want to go see Dr. Aggarwal because he's going to have to do that thing to me. That's just simply not the case. So with cancer screenings, we do annual blood tests to check for prostate levels, and then we do colonoscopies periodically, depending on what you find in the colon. And then beyond that, if patients are having certain symptoms or certain family histories, then we think about other cancer screenings as well. But predominantly, when I have a patient in the office, male or female, but particularly a male, I think about what are your risk factors for heart disease? How do I identify and prevent cancers? So those are the top 2 things for sure. The other things I think about with men's health, I think nutrition. So a lot of us don't eat as well as we probably should be eating, and a lot of us are maybe drinking or smoking a little bit more than we should be smoking or drinking. So I think about lifestyle changes. And then the last thing would be sexual health. Just being aware that sexual health is important. Things like erectile dysfunction, low testosterone are very common. If you listen to the radio or TV or have a conversation with your buddies, inevitably somebody's going to say, oh, I take testosterone, or I know somebody who takes testosterone. And so just having those conversations with a doctor who really understands what testosterone management is, I think is important.
Okay, so out of those 5 big topics of health concerns for men, I mean, it's out there too that, most journals that you read and stuff will indicate that men die younger than women. So is it in lieu of those 5 big topics that are killing men?
Yeah, so this is a really tough question to answer. Across the board and across every country, men live approximately 3 to 6 years younger than women do. Right. And that doesn't matter how wealthy a country is. It doesn't matter where the country is in the world. It doesn't matter about anything other than the fact that men live shorter lives than women do. So there's 2 schools of thought on this, and my personal view is both schools of thought play a role. So the first school of thought is genetics and hormones. So we know that women have estrogen. That's part of what makes a woman a woman. Estrogen is protective against heart disease, and that's one of the leading causes of death in this country. So that is an advantage that women have for reducing their risk of death. Equivalent to that is men have testosterone, and we know that testosterone can actually promote heart disease, and men have higher levels of testosterone. So that's one reason that suggests why women live longer than men, is that women are slightly protected against heart disease compared to men. The second thing is, and I think any male out there or any female who knows a male out there would attest to, men are generally more careless than women are. Men are generally more likely to smoke more, they're more likely to drink more, they're more likely to have higher rates of anxiety or depression that go untreated. We know the literature behind suicidality or suicide rates are higher in men. We know that men are more likely to drive less safely. We know that men are more likely to engage in high-risk behaviors like skydiving and driving faster on 75 than one should. And so there is a social, personal perspective, but I think there is also a genetic perspective of hormone changes. One of the things that I found interesting when I was reading about this in the past is it turns out that when you look at newborn babies, like premature babies that are born, there are more male preemies than there are female preemies. So this dichotomy of males versus females happens in utero. So this is not just men are more careless in their 40s and therefore they die more frequently. It's that there is something we know genetically that's occurring based on the chromosomes, before we were even alive.
Oh, that is so interesting. Yeah, that is very, very interesting. Yeah, so, when we're also talking about men and staying healthy, I know a lot of men do not like to go to the doctors. So what can, besides encouraging them to go, like you said in our opening discussion, what else could they do at home to stay healthy?
Yeah, that's a good question. So, when you're at home and living your day-to-day life, I think the things that I personally focus on as a physician at home are really what am I eating and drinking, and how active am I in my day-to-day life. As a young dad of 2 young kids, most of my energy goes towards kids and work, and I have convinced myself that I don't have enough time to be healthy or to work out. But we all know that's just not the case. We all can dedicate a little bit more time for our own health. And so if you're the kind of person that does not want to go to the doctor, you've got to find that voice inside you to say, I commit a lot of hours in my life to various activities. Committing an hour to go see Dr. Aggarwal a year is well worth my time. Beyond that, I think when you're at home, I would encourage everybody to be aware of 3 things. So number 1 is, how much are you drinking on a regular basis? We know that alcohol is associated with a myriad of health conditions. Number 2 is, how much starch do you consume? So I think a lot of folks say, oh, I'm pretty healthy, I don't eat dessert. Well, that's good, but I would argue that starch plays as much of a role, if not even a bigger role. And so what are some common starches? I think about rice, potatoes, bread, pasta. These are foods that are delicious, that we all have a lot of access to, but those are just not quite as healthy for us. And so just being mindful of your starch intake would be number 2 at home. And then number 3 is finding ways to be active. So if that means taking a walk around the neighborhood, if that means getting some dumbbells at home and being a little bit more active with strength training, if that means having a personal trainer, if that means coming to the J to get to exercise, but just being more active, I think is important. So outside of seeing a doc once or twice a year, in your day-to-day life, how much do I drink? How much starch do I consume? How active am I?
Change starch for fiber.
That would be great. It's not as tasty, admittedly, but that would be ideal.
And what about like home screenings? Because this is the world of virtual, and so how about are there some home screenings that men can do at home? Or then those maybe can still come in at least once a year, but some self-monitoring at home.
Yeah. So this is a really tricky one. So as I mentioned previously, I'm a concierge medicine doctor, and to me what that means is that patients have access to me 24/7. So when something comes up, they can reach out to me, call me, or text me, or email me. Despite that model, I'm a little nervous about the home screening concept because patients, it's almost like you get on Google and you can just buy whatever you want. And I think there's a lot of misinformation out there, and I think there's a lot of tests that are frankly pretty expensive that may not be clinically relevant. And so I'm on the side that I tell my patients, if they want to go down the road to get these tests, just let me know about it beforehand, because I can guide you. I'm not saying never get a test off the internet, but there are some tests that are better than other tests. Or one of the challenges that we run into is a patient will come to me with a handbook and say, I got this test online, what do you think? And when I read it, I don't know what to think. There's just not enough science behind it, or there's not enough data behind it. And so it can cause a lot of undue anxiety for patients when, gosh, they really just need the test to begin with.
So speaking of those tests, what would you suggest would be the 5 screening tests if they came to visit you that you would, are there 5 or 4? What's the big amount?
Yeah, absolutely.
For men?
That's a good question. So, routinely I'll get an EKG. EKGs are a test to assess what the heart is doing. It's where most folks on this probably have gotten one in the past. You lay down flat, they put a couple of stickies on your heart, and they're basically just measuring your heart rhythm and getting us some basic information about the structure of the heart. I think once a year or once every other year, that's appropriate. Doing some blood tests is always important, looking at your blood counts, your basic organ function. These are easy, routine things. You put your arm out, they get one little poke, you get a couple of vials of blood. For the most part, it doesn't cause you any undue stress, any undue health issues, but it gives us a really good baseline as to what's going on with your blood counts, your kidney, your liver, your cholesterol, your diabetes. So I think the second category would be just blood work. So first was EKG, second was blood work. And that really comes down to me and the patient coming together and saying, do we also want to check some vitamin levels? Do we also want to check various other things? Thyroid level, for instance. The third thing I would say is updating those cancer screenings I mentioned. So, this morning I saw a 54-year-old who has not had a colonoscopy. That was due 4 years ago, so we're going to get that for him. This 54-year-old had an extensive family history of heart disease, so we're going to get some heart testing for him in the form of something called a calcium score to tell us how much plaque he has built up. I'm going to do that for every single patient, but if somebody has symptoms, risk factors, family history, etc., we should get some heart screening done as well. And then I think the last thing that I would say, particularly for men, is I always have a conversation about testosterone. So testosterone it's a buzzword. If you listen to sports talk radio or if you're on Google or anything, it seems like every single person is on testosterone, and it seems like every single person thinks it's the greatest thing ever. And it turns out that in some ways it is pretty darn good, but there are a lot of downsides to testosterone. And as an internal medicine doc, I'm antsy about the freestanding centers out there who are almost just giving out testosterone to anybody who wants it, because it does come with its fair share of issues. And so I'm always very transparent in the office. I always am open to checking testosterone levels, but then I really want to have a risk-benefit discussion before getting on testosterone. So if you as a listener come to see me in the office, you're going to get an EKG, you're going to get labs, you're going to get updated cancer screenings, you're probably going to get potentially a heart screening, and then we'll discuss sexual health in the form of prostate health, testosterone, erectile dysfunction, and so on. That's a pretty standard physical in my office.
Okay, so at what age should this process begin?
Yeah, I would say when you're in your 20s, you should get a blood test for sure, maybe once or twice in your 20s, just to have a baseline. And then I would say starting in your mid-30s, it should be every year. One could argue even at 30 years old on the dot, it should be every year thereafter. And, like I said, when patients come to see me in the office who are 32 years old, it's a quick visit. How are things going? What can I help you with? What do you have going on? And chances are they don't have much or anything, but it's a really good baseline. Let's see what the heart looks like in the year 2022. Let's see what your blood counts are. Let's see what your testosterone is. Let's see what your pancreas is doing. And then they'll come back in a year or two and we'll do it again. But I would say starting in your 30s, this really should be an annual 1-hour check into your doctor.
Okay, so starting in our 30s.
I would say so, absolutely.
Okay. And straying away from that a little bit, there's a lot of where men hold on their shoulders a lot of the stress for just day-to-day lifestyle. So how does stress affect men's health?
Yeah, I think it plays a paramount role. When I trained in residency in medical school, I don't think I really appreciated what mental health meant. I was always focused on heart disease and acid reflux and asthma and migraines and all those other things. But it turns out that mental health, I think, is as paramount, or if not more paramount than anything else, because if somebody is not in a good headspace, if somebody's having a hard time managing their emotions, their anxieties, or their depressions, a lot of the other stuff doesn't really matter because somebody is really struggling. And so I think with men in particular, we're not very good at sharing our emotions, and certainly not very good at talking about our emotions with myself as a physician. So that's something that I proactively talk to patients about on a lot of visits. And I'll say, how are things? Like, I get that you're doing well, I get that your labs look good, I get that your EKG looks good, but how are you doing? What's your headspace like? What's your mental health like? Are you excited about things coming up in the future? Because very rarely does somebody come into my office and say, hey, I'm anxious. Hey, I'm depressed. Usually it's, my gut's all screwed up. Or, I get these intermittent bouts of chest pain. Or I get migraines. Or I get achy. I'm sleeping more. I'm eating more. I'm gaining weight. And I interpret those things as, could there be something mental health going on here? Is this patient treating their anxiety with food, which is a very common thing to do? Is this patient treating their work-related stress with alcohol? Again, a very common thing to do. And so instead of waiting for patients to bring it up with me, I just, as a standard, I bring it up with patients in a very non-assuming way. A lot of patients don't have these symptoms, but man, a lot of patients do. And it's been very refreshing for me to be able to address those and treat those. And the patients feel like $1 million, and it's great. It's very rewarding.
Oh, that's awesome.
Yeah.
You would be great to come visit. I hope you guys take it.
Absolutely. I'm happy to see you guys.
Yeah, and when you're also thinking about from stress, but also, you are what you eat. And is there any difference between some of the good superfoods for women versus men? Or are all the good superfoods out there just for everybody? Yeah, I think they're for everybody. If you were to Google or ask around your friends or your colleagues about like what diet is good, I think a lot of people will throw out a lot of fads or a lot of things that are kind of hard to accomplish. I had a patient recently who did a cabbage diet. And the thought of just like being on cabbage 2 or 3 times a day is just not realistic. I mean, yeah, I'm sure you feel better and you sleep better and you lose weight, but at some point you're not going to just eat cabbage 2 or 3 times a day. I would encourage everybody to look at the Mediterranean diet.
That's the only diet proven in the literature to be heart healthy and associated with weight loss. The Mediterranean diet is pretty darn easy to achieve if you are not a vegetarian, because it is seafood based. So it's a lot of seafoods, obviously fruits and vegetables, olives, some healthy cheeses, olive oil, and it's a pretty straightforward one to follow. The challenge is if you're vegetarian or vegan, you can't do the seafood thing, and then you're sort of left dry, if you will. But the Mediterranean diet is a really healthy, safe, sustainable option.
Yeah.
But yeah, men versus women, I think, healthy foods are healthy foods.
Yeah, I guess the Mediterranean diet would be good unless, of course, you're allergic to
Of course.
seafood.
Of
But
course.
other than that, that sounds like that would be a good one.
Yeah, absolutely.
Yeah. And one more question here on sexual performance enhancing drugs. How do you feel do they work? And is there, or what are the benefits of sexual performance drugs? Or is there just a lot of negativity and not really as many benefits, if you're going to weigh the two?
Yeah, absolutely. Well, I think about this in two categories. So the first category is hormone-based, and the second category is performance-based. And so when a patient comes to me with erectile dysfunction, which is very, very common, it can start as early as your mid to late 30s. So when the male who is 60 comes to me with it, in my eyes, it's good for you. You didn't have it until you were 60. Because I've got a lot of men at 38 who come into me with these symptoms. So when a patient comes into me with sexual issues or erectile issues and so on, I distinguish two different things. So number one is there a hormone imbalance? So that's when we check that testosterone level. When patients get on testosterone therapy, it helps for the most part. And most patients say, my gosh, this is a game changer. I feel better, I feel stronger, I'm emotionally better, sexually I'm doing better, I'm just better. The issue with testosterone is it requires a lot of effort from the patient, because that patient needs to come to see me at least once a month, if not more frequently, to check blood work done. Because testosterone has some adverse effects. Too much testosterone increases the risk of heart disease, which I don't like, increases the risk of blood clots, I don't like that either, increases the risk of prostate cancer, I don't like that either. So if a patient comes to me every month for testosterone and we have a really good balance and we manage it really well, it's a great drug. I do not talk people out of testosterone. I talk people out of careless testosterone. When they just go get a script every 3 or 4 months, they get labs every 3 or 4 months, that's a really scary deal. But if somebody is really diligent with their testosterone use, it's a game changer for a lot of folks. So I really support that in the right circumstances. The second category that I think about is just erectile issues. So, ultimately, the penis is just a different organ, and it's just relying on blood flow, just like anything else, just like my arm and just like my kidney and my liver. So there are medicines out there that anybody who's watched TV has seen commercials of, things like Viagra or Cialis. Those are also quite safe drugs, and I'm perfectly open to prescribe those drugs. I think there's some medical history stuff that I'd be a little bit more wary about if somebody had recent heart disease or a heart attack. I'd weigh some risks and benefits. But ultimately, if a patient brings these symptoms to me, that's the hardest part of the conversation. It's the patient owning it up and saying, it's just not working anymore, doc. It used to work and now it doesn't work. What do we do? Once that conversation takes place, I will treat it and effectively treat it and safely treat it. But it's just a matter of going to your doctor and being comfortable and saying, hey, listen, we talked about my migraines and we talked about my acid reflux. By the way, this is also going on. What do we do? So I am all for prescribing folks testosterone. I'm all for prescribing folks some enhancing medicines like Viagra or Cialis, but it has to be done in the right circumstances under good supervision, which as an internist is up my wheelhouse. I do it all the time.
So supervision is the key.
Absolutely.
Great. Well, do you have anything else that you'd like to share with our viewers in regards to men's health? And this is, the month of awareness.
Sure.
But I feel like that the awareness should be every day of the year as opposed to just looking at it November.
Yeah. I would ask everybody listening to ask themselves or ask their male in their family 5 things. What's your blood pressure? What's your cholesterol? Do you have diabetes? What's your headspace? And how much do you drink? And how much do you exercise? So I cheated. That's actually 6 things. So let's recap that. What's my blood pressure? What's my cholesterol? Do I have diabetes? What's my headspace? How do I eat and drink? How do I exercise? If you can identify those 6 pillars and work towards those 6 pillars, you're going to prevent most diseases that come across. That does not mean you should not go to your doctor. But that means that when you do go to your doctor, things are going pretty well. And a lot of the counseling and the things that keep me up at night for patients, the patient is already addressing themselves with healthy habits, frequent blood checks, and so on.
Okay, so let's remember those 6 pillars.
Absolutely. That's it.
All right. And final question. I know you are a Cowboy fan.
Delusional and diehard, yes.
Yes. Cowboys have a bye this Sunday.
Yep.
However, the following Sunday, they're playing in Green Bay.
Absolutely.
All right. What do you think the outcome's going to be?
We're going to win. There's no doubt about it. I'm thinking 31-17, Dallas Cowboys victory.
All right. 31-17. And don't forget about those 6 pillars.
Absolutely.
All right. And guys, it's time to close this one down, but thank you so much. And remember, when you wake up, get wealthy. I'm Terri Arends. Until next time, we'll see ya.
Thanks.
Bye-bye.